Some good news in the fight against COVID-19. Moderna rolls out its vaccine across the United States. But even with that step forward, a new coronavirus variant is causing global concern. Hello, I'm Anand Naidu, and this is The Heat. A new coronavirus strain that has been detected in the United Kingdom is raising fears that it could spread to other parts of the world. More than 40 countries have banned arrivals from the United Kingdom. Meanwhile, here in the United States, where more than 318,000 people have died from COVID-19, there is a positive development as Moderna rolls out its vaccine. Some people have already received that vaccine.
This first wave of Moderna shipments will be sent to more than 3,500 sites. A greater number than the Pfizer vaccine was sent to, in part because the Moderna vaccine can be accommodated in more sites, including harder to reach and more rural places.
There is lots to discuss, so let's get to our panel. Joining me now from Washington, D.C. is Dr. Gavin Macgregor-Skinner. He is an infectious diseases expert and the director of the Global Biorisk Advisory Council. Also with us from Scottsdale, Arizona, is Will Humble. He is the executive director of the Arizona Public Health Association. Joining us too from San Francisco is Dr. Alok Patel. He is a pediatric hospitalist and medical journalist. And from Beijing, we are joined by Einar Tangen. He is a political and economic affairs commentator. Thanks to all of you for being with us. Gavin, let me start with you. There are alarm bells ringing over this new variant, this new strain of the coronavirus, which has been detected in the United Kingdom. In fact, there are a number of countries, as I mentioned, 40 in total, that have shut air and land links to the United Kingdom. But the WHO, the World Health Organization, says things are not out of control. Here's Michael Ryan of the WHO.
Even if the virus has become a little bit more efficient in spreading, the virus can be stopped. The R0 is around 1.5. That means the virus can be stopped, and we've had R0s much higher than 1.5 at different points in this pandemic, and we have got it under control. So this situation is not, in that sense, out of control, but it cannot be left to its own devices.
So, Gavin, how concerned are you about this virus, this new virus?
Very concerned. Now, we've known about this new mutation or variant since September of this year, where it was confined to the southeastern region of England. But what we saw last week, it's moved into London, and it's now the major type of the SARS-CoV-2 virus that's circulating in London. 6 out of 10 of the patients that were diagnosed last week have this new mutation or new variant. So I've got 3 questions right now. The first question is this new variant or mutation more deadly? Has the clinical symptoms changed? That's my first question. The second question is, can this new variant of the SARS-CoV-2 virus, when it's in the body, can it avoid antibodies generated by previous infections or even antibodies from vaccines? You know, we're rolling out the vaccines around the world. And the third question is it more transmissible? Is it easier to catch infection? Now, for questions 1 and 2, we have no information. But the great concern I have right now is for question number 3. And we're hearing early reports from our colleagues, both in England as well as the European CDC, that this new variant may be more transmissible. It may be easier to catch. And if it's more transmissible, say 40 to 70%, based on the current infection rates, that means the number of cases could double in 6 to 7 days.
And Gavin, I'm guessing that the answers to questions number 1 and 2, whether it's going to be more potent and whether it would be able to resist antibodies in the human body, we would only know the answer to that in the weeks to come.
That's right. And we've got to be very clear. The experts have to be really clear here that the things that we don't know, we have to be brave enough to say we don't know. It's going to require research. It's going to require more investigation. So stay tuned. More information is going to come very quickly, especially out of the number of patients we're seeing in London.
Alok Patel, as I said, many countries have banned arrivals and departures from the United Kingdom, 40 countries in total, over this new variant. But what is the likelihood that it's already got out?
You know, I have to echo what Dr. Macgregor-Skinner was just saying, and saying that now is not the time for people to panic, but just to pay attention to the reality and the fact that it is totally possible that this strain is in other parts of the world before it was detected. Part of the reason that it was detected so eloquently in London is because of the TAC PCR system was able to pick up basically the variant that was that had a deletion that was seen in PCR. So it's possible it's all over the place. And I think it would be dangerous for people to kind of jump the gun and make speculation about transmissibility, increased virulence, or it being able to avoid the immune system or the vaccines before we know more. The one thing that we do have to pay attention to is the reality that vaccines do mutate. On average, the SARS-CoV-2 virus has been mutating about 1 to 2 mutations per month. This specific variant has more than a dozen, and there's a few mutations that scientists are looking at right now that involve the spike protein and the virus's ability to kind of latch on to the human body. But as of right now, we have to wait for more, but scientists do speculate that the vaccines that are in development will still work against this strain. And if there is any doubt of that, this specific strain needs to be put on top of a priority for genomic sequencing so we can closely monitor the strain and contact trace anyone who possibly has it.
Now, look, the United States is one of the countries that has not imposed a ban on flights from the United Kingdom. In fact, the governor of New York State, Governor Andrew Cuomo, he is calling for a flight ban. Are authorities in this country listening to the experts right now?
Well, I can openly say that in the United States, we seem to have a little bit of a disjointed response between the different states. Local and state health departments right now are paying very close attention to the strain and seeing what the recommendations are. And I think we may see some movement happening within 1 or 2 days. Now, whether or not there's a national ban, I don't even want to get into that because I don't think there will be, but I think certain states may enact some type of warning or at least a compulsory mandatory period for anyone traveling from out of town. We already had that in effect in many states. The question becomes will there be a ban from flights from the United Kingdom? And will it even make a difference? Because if it's already in other parts of the world, there's flights coming in from a lot of different countries where the variant could definitely come here. We've seen that happen multiple times throughout the pandemic, and it could happen again. I think the important thing is people just have to keep doing what they're doing, staying home, washing hands, wearing a mask, and being safe.
All right, let me go to Will Humble. Will, there are now 18 million cases in the United States, and we know that 318,000 people have lost their lives to COVID-19. We're also facing another holiday period, the Christmas period, which is just coming up this week, when there'll be lots of travel, lots of people meeting in possibly large groups. Could we see another spike?
Well, I think it's going to vary state to state. You know, that's one thing that we know for sure here in the U.S. We have 50 different governors who make 50 different decisions around, you know, what the mitigation measures are in their states, whether bars, restaurants, nightclubs are open, what are the limitations on large gatherings. But like Thanksgiving, you know, the Christmas, that week-long, really it's a 2-week period around Christmas and New Year's, is a big mixing holiday. And obviously that's going to drive some additional human behavior that ends up resulting in amplifying this virus. And so that's why I think it's so important for us to stay focused on those mitigation measures that we know work. I am not a big fan of a travel restriction from Europe or any other countries because I think it diverts attention from the core public health interventions that we know do work. That's the masks, the distancing, staying close to your own cohort. And we are just so close here in the U.S. and around most of the developed world to be able to have access to a vaccine, especially high-risk persons. And it would be a real shame to just give up at this point because people are just so tired of those tried and true public health measures about distancing, face coverings, et cetera.
Gavin, what are your thoughts on travel?
Well, I travel every week for work, and what I'm seeing, and I've been doing this, you know, I've been traveling every week since January of this year. I do training in hospitals, nursing homes. I've just come back from Reno, Nevada, where I traveled down to help some hospitals and also the vaccination clinic that I was setting up there. What I'm seeing right now is the airports are becoming more crowded. There are bottlenecks in those airports which cause overcrowding. The planes, the airlines are doing a fantastic job in enforcing the wearing of the mask, giving really good information on how they clean and disinfect the planes, but more importantly, how they manage getting onto the plane and getting off the plane. So they're really trying it. And this is all about human behavior. Right now, this virus spreads based on how people behave. And again, as Will was saying, if we can maintain that consistency, do the simple things to every person in America, and again, around the world, do the simple things will break the cycle of transmission. So yes, I'm seeing more and more people travel, but I'm also seeing more consistency in wearing the mask, washing their hands, and keeping some physical distance where they can. So that's still going to be challenging as we move into 2021.
So getting some clarity on this, Gavin. So what you're saying is that the travel doesn't really matter if people continue to wear masks, wash their hands, and practice social distancing.
Well, I think as we travel, we only have very brief contact with people. And what we're seeing, it's those social gatherings, it's those gatherings over time indoors in confined places, which is the highest risk factor.
Right. All right, let me go to China, to Beijing, and get the view from there. Einar Tangen, China has managed to contain the spread of the virus, but what about vaccines in China? I mean, what is the plan to inoculate key groups over the next few months?
Well, over the weekend, the Chinese government indicated that they have not approved their vaccines for public use, but there's already 400 million doses which will be going out internationally. And this is a big sign of hope, given that currently most of the vaccines, especially Moderna and Pfizer, have been gobbled up by the developed countries. So at this point, hopefully it will not become political. I noticed my colleagues were talking about this, but they didn't mention test and trace. This has been key to China's ability to handle this virus, to make sure they know exactly who has it, who they've been in contact with, and prevent it from spreading around, not just hand washing, etc. But the most important thing is not to make this political. I'd be ashamed if somebody started saying the UK virus or something like that.
Right.
So at this point, China has a very active plan, and they have a slightly different methodology. They're using, in essence, a deactivated virus. They put it in the body. It cannot replicate, but it helps stimulate those kinds of antivirals that are necessary for people to ward off this pandemic.
Alok Patel, testing and tracing, we've heard that mantra so often. What is the situation in the United States?
Well, it's a broad question because it seems to differ on where you are in the United States. So testing seems to be going on a roller coaster where, we had huge backlogs in testing in spring. It improved in summer. It then backlogged again in November. And now once again, it loosened up a little bit, but it depends on the situation and depends on the location. Because remember, when it comes to testing, it's not just the test itself. There's also personnel needed to run the test. There's equipment you need to run that test. Then there's chemical reagents or things to actually get your sample. But one big improvement that's happening here is the FDA has approved home tests, which hopefully will come to more fruition. And we'll get more data about how well they work. But that's actually a test that people can order or they can buy at a store over the counter, get it and get the results at home and kind of avoid all the lines and potentially coming in contact with other people. But I do think as we move forward, contact tracing needs to be at the top priority. I agree with both of my panelists, my co-panelists, that as we're moving forward and getting widespread distribution of the vaccine, people still need to be staying home and doing everything they can. And if there are any other outbreaks, we need to contact trace them absolutely to a very detailed degree to figure out where they're happening and potentially what variants involved.
Gavin, talking about vaccines, both the main vaccines in the United States, the Pfizer vaccine as well as the Moderna vaccine, they are now being rolled out. They're being injected into the arms of people. Is it too early to say if this is the beginning of the end?
Yes, it is. It's way too early, and I'll tell you why. Again, it takes time. Both the Pfizer vaccine and the Moderna vaccine require 2 doses. Pfizer, 21 days apart. Moderna, 28 days apart. So when you work on the front lines like I do, you need 2 completely separate plans, one for Pfizer, one for Moderna vaccines. The other big challenge we have right now is that then after you get the 2 doses, then we have to then measure the antibody response, what protection those individuals are going to show us, so we can learn and then extrapolate that information for the rest of the public. The other challenge we have right now is people. And just exactly as we're talking about right now, people are still doing contact tracing. They're still doing case investigation. They're still answering telephone calls 24 hours a day, 7 days a week to answer questions. And now we're being told to stand up and train vaccination teams. We're running out of people to do that. As more vaccines roll out, we're going to need more people, and those people have to be trained on how to deliver the vaccine. So we're getting really stretched on the front lines.
Will Humble, what is the situation in your state of Arizona insofar as facilities and, as Gavin just mentioned, people are concerned?
Well, the big issue here is staff at hospitals. We are in a real hospital crisis, shortage of respiratory therapists, ICU trained nurses. Well, I'll tell you, more than half of the patients that are in Arizona hospitals right now are in there for COVID-19. And what that tells you is there's a lot of people that have been displaced from the hospitals. And right now we're using what's called contingency levels of care. What that means is people who would normally go to an emergency department with COVID-19, they normally would be put up into a hospital, given a bed for monitoring and treatment, but are probably being sent home if their acuity isn't to that threshold that's too scary. Likewise, moving from regular wards to intensive care. And it's just putting this enormous strain on the healthcare workforce, not just the public health workforce like we just talked about, but just healthcare. And we are in a real hospital crisis in Arizona.
Alok Patel, are you finding that as well, that people who are coming to hospitals are being displaced by COVID patients?
Unfortunately, it's happening in California to a dangerous degree. In Southern California, we actually hit a 0% free ICU beds last week, which is unheard of. And that's across all of LA County. Right now, it's a little bit higher than that. Now it's like 2% ICU beds available, but that's dangerous. Because, as we mentioned earlier, we have a huge holiday season coming up.
Right.
We could see a surge on top of a surge, which could stretch our healthcare workers extremely thin. And, just building on what Gavin was mentioning about vaccine distribution, right now we're seeing vaccines rolled out across healthcare facilities and clinics. CVS has also announced a plan to start vaccinating people in nursing clinics. But we have to think about in the future these underrepresented communities who don't have the resources that we see in bigger cities, and what we're going to do to get the right healthcare personnel out there everywhere to not only make sure we're getting the vaccines into arms, but we're also building trust with the communities. That all requires personnel.
Those areas that you're talking about, Alok, rural areas, hard to reach areas, will they be helped by the Moderna vaccine?
In theory, because the Moderna vaccine doesn't necessarily have to have the same deep freeze requirement as the Pfizer vaccine. But remember, a vaccine available is only as good as people who are willing to take it. Yeah. So logistically, the vaccine has to be able to get to these areas, but also we have to make sure that people go and get the shot. They have the right information to go. They trust the system. People are speaking directly to them. And if they have any adverse responses, they're reassured and they show up for the second shot, assuming that it's a 2-dose shot.
Yeah, Gavin, how big a problem is that going to be? The fact that there are many people we are hearing who will not take this vaccine. And as Alok Patel just mentioned, we've heard about allergic reactions from some people.
Yeah, in the communities I'm working in right now, I'm actually seeing 3 groups start to develop. There's that group 1, the influencers, the people that understand the science, understand the technology, and are on that list of essential employees to be vaccinated first. And what we're hoping is that group 1, that first group, will then influence the group 2. These are the people that are sort of sitting back going, oh, I might wait a little while. I want to get vaccinated, but I need to see how group 1 deals with it. And then once we get group 1 and group 2 vaccinated, then we've got group 3, which are people who are saying, I may wait longer. These aren't the anti-vaccination people. These are people that just want to see what actually happens over time. And they may be lower in the essential employee list. They may not even be on that list. So we've actually got 3 groups now. We're going to use the first 2 groups to influence the third group. But what we want to avoid right now is a patchwork effect. Don't just randomly send out the vaccines to many, many destinations and only vaccinate a very small number, because then we're going to get this patchwork effect, and it's going to lead to lots and lots of confusion, both for professionals as well as the general public.
Einar Tangen, there is one other issue. There is global concern right now that rich nations are buying up all the vaccines and that poorer nations may not be able to get their hands on these vaccines for months to come. What is China doing to alleviate that kind of situation, to help out these poorer nations?
Well, as I said, they've taken orders for 400 million doses, and China has a slightly different approach. Because of what they're doing, it's very similar to the flu vaccines that have been produced around the world for many, many years now. And as a result, it can be put into production in other areas. So China has made it very clear that they are dedicated to making sure that this is available not only through COVAX, but also through bilateral ties. You have Indonesia that's ordered 126 million doses, and that's enough to cover 126 million people. This is very, very important to so many countries. I mean, you even have Singapore in there that has ordered quite a large number in order to vaccinate their people. So you're seeing it across it. But what's interesting is you're seeing areas like South America, Africa, ASEAN, and the Middle East These are the ones that have confidence in what China is doing, but you're not seeing that in Europe or America or other areas. So it seems, unfortunately, that this continues to be a politicized result, not just based on science.
Will Humble, we saw President-elect Joe Biden get his vaccination today. That was on Monday. Here's some of what the President-elect had to say.
It's one thing to have the vaccine show up at a hospital. There's another thing to get the vaccine from that vial into a needle, into an arm. And there's millions of people out there that are going to need this, frontline workers first.
Will, Joe Biden did give some credit to President Trump for the quick rollout of this vaccine, but we know that the White House has come under very, very harsh criticism for its handling of the pandemic. What are some of the things that you'd like to see Biden do better?
Well, it would start with messaging, that's for sure. And, you know, the messaging from the federal government, from the president on down from the start was confusing and often completely inaccurate and really counterproductive. And I'm talking about the president here. So I think President-elect Biden has a much leveler head when it comes to listening to the science. And I expect that to be the first improvement. And we're seeing that improvement already as President-elect Biden continues to get more attention as he will be in office shortly. So I think that the weakest part has been the communication part of it. The strength has been the vaccine. I will say that. I mean, the administrative barriers that were removed here in the U.S. to encourage these vaccine manufacturers to get vaccine generated and manufactured much quicker than they would have been is kudos to both Congress and the White House. So that's the federal response.
Alok Patel, you are among those people who are working on the front lines trying to counter this pandemic, and we have a new administration coming into office. What would you like to see? What can change right now? And I'm just thinking of something one of the panelists said earlier on, that the United States is unique in one respect, in that you have the federal government and then you have 50 states doing 50 different things.
And what I would love to see, and I'm raising a glass to what Will just said, is I would love to see consistent, transparent messaging around the vaccine response, around the pandemic response in total, to not only rebuild the public's trust with what's happening with coronavirus, but with science in general. And I think all 50 states having disjointed messages erodes all of that. In the past year, we've already seen criticisms against the FDA, the CDC, and the WHO from this current administration. And what does that do? That causes people to look at scientific headlines and listen to public health officials and question what they're hearing. And now the scientific community is almost playing catch up. And I really hope that we can reverse that course with the new administration and the coronavirus task force. I think it's going to be a challenge for all of us. I do think we can get there. So I think the American people are finally awakened to what's been happening right now with misinformation.
Einar Tangen, you know, as I said earlier on, China has managed to bring this pandemic in China under control. It's managed to combat the virus. But how much concern is there when we hear things like a new strain of the virus going around, that there's a new variant? I mean, what are the biggest challenges that China faces right now in keeping things under control?
Well, China's approach is significantly different, and I keep going back to this idea of tracing. In China, tracing is done automatically. You have a QR code when you go into a store or a restaurant or even your own place. They will actually record where you're going. They use GPS. For many in the West, this would be an invasion of privacy, but this has been key to China's response. So they're not as concerned about our factors because people do use social distancing. They do wear masks. They do stay at home and isolate when they're asked to. So it's not as big an issue for countries unless they're not having an effective trace program. A trace program in the United States is somebody getting on the phone with a list of people and trying to get people to remember where they were and who they might have talked to, and then trying to follow that along. Very far from being efficient, and quite frankly, because of the issues that have been mentioned about getting healthcare workers and the amount of money that's involved, it has not been a very robust response.
Gavin, what about the longer-term outlook? I was reading some stuff today about from experts who say that at least 70 to 80% of the United States population would have to be vaccinated before we get any kind of herd immunity. What does that mean?
Yeah, so that means the number of people, the actual number of people that need to be vaccinated and have an antibody response to show there's some protection so we can break the cycle of transmission and decrease what's called the viral load, or amount of virus that's circulating with our communities. As we've seen with the numbers every day, number of hospitalizations, number of tests, we're at an all-time high, and we've been like that now for a couple of weeks. But the biggest concern I have right now is patience. Can people be patient and wait for not just weeks but months for it to be their turn to get the vaccine? And right now, what we need is good education, better coordination, better information on when you most likely will get the vaccine, so people can be patient. And that's going to be a big challenge for us.
Yeah, Gavin, as you say, patience, but realistically, at what stage or how many months into this do you see or do you expect a dramatic drop in the number of infections?
That's going to be really based on the supply chain, the manufacturers, how many vaccines are coming out, the distribution, the number of people. So there's a lot of moving parts here. There's a lot of elements that have to be in place to actually get the jab in the arm. It's going to be months, and I'm on a number of government committees. We're still talking about fall or October, November 2021 before we're going to reach those magic numbers in certain communities. It's so important now we start to map where people have been vaccinated so we can have good situational awareness and we can monitor those numbers. And that's going to be real challenging for us to maintain that information, that documentation, but also to again, as we've talked about, that communication that's required. Yes, your turn is coming. It's not yet. It's going to be months. You need to be patient. That's going to be really, really challenging for all of us.
Alok Patel, there are more vaccines on the way. There would possibly be others be approved pretty soon. Are you hopeful we're at a turning point?
I am hopeful we're at a turning point, but I have to just echo the sentiment that the vaccine on its own is not the silver bullet we need. It's the vaccine in conjunction with all the other measures. And I do think that once we get more vaccines, not only with more shipments for the Pfizer and Moderna vaccines, we'll better be able to address all the potential shortages out there when it comes to distribution. But we really do have to make sure that the distribution is done in a responsible manner and that there's very clear communication on what 1A, 1B, 2, and et cetera actually means. So people know that vaccines are going to a responsible source, and we don't hear stories about, people possibly trying to buy a vaccine or, them going to somewhere where they shouldn't be, or not to an essential worker and instead to a congressman. And these stories are already emerging. We just have to get on top of them.
And that's where we have to leave it. Thanks to all of you. That's been a great discussion. And that is it for this edition of The Heat. We'll see you the next time.